Hey friends, welcome back to my channel. Today we're going to talk about nursing school clinicals, what to expect, and then at the very end I'm going to do a little what's in my clinical bag for you. Alright, so before we get into it, I just want to say everyone's experience is going to be a little bit different based on the department you're in, the school you attend, you know, how hands-on they allow you to be. You might be fully hands-on, you might just only be able to watch, so everyone's mileage may vary. So the advice I give you guys today and the stories I tell are based on my time in a subacute unit. So I was totally fully hands-on from day one in my first semester. And if you're not really familiar with a subacute unit, basically all the patients have to be fully trached. A lot of them are on ventilators. It's kind of a long-term care type of place, so there's patients that have been there for several years. I guess my take on it is basically they're not critical enough to be in ICU, but they're not yet well enough or stable enough to live on their own at home. We briefly interrupt this for the pink drink. So just to give you guys a little background, I worked as a caregiver for several years, and then in an assisted living facility. Whew. So in this video, I'm going to do my best to really make all my suggestions and advice very universal. There's a lot of general things about the clinical experience that are going to be very similar for all of us, but you know, again, it depends on what your school allows you to do, how hands-on you could be, where you do your clinical, so there are going to be variables that are very different. So I'm going to glean from my experience and kind of give you guys general universal advice. Alright, so you've been accepted to nursing school, good job, and you might be wondering what are clinicals going to be like. You might be a little nervous, a little freaked out. I know I was. You kind of don't know what to expect, I guess, so it is a little freaky. And I mean, that's totally normal for anyone, because anytime you've never done something before, because you don't know what to expect, it's going to kind of freak you out until you do it and you see what it's all about, and then you realize, not so bad. So I just want to say, remember that every nurse has gone through this. They made it through. You can too. You probably will make a few mistakes here and there. Don't make any mistakes. But this is your opportunity and your chance to really learn as much as you can and gain that experience before you're thrown out as an officially licensed RN. So definitely take advantage. Use this time to really pick the nurses' brains, let them take you under their wing. Anytime you see an opportunity to do anything, whether it's inserting a catheter or doing wound care, you know, whatever it may be, just jump on that opportunity and try and get as much experience as you can. So first, I kind of want to talk just a little bit about how it works, kind of just a really general overview of what to expect. You're going to be assigned to a hospital or a healthcare facility, and you should find this out relatively soon in your semester. Once you have that location, you're also going to know your clinical days and your hours. Now, from my experience in the schools that I'm familiar with, you typically will go a couple days a week and you'll do either 8 or 12-hour shifts. So for my cohort, we did Thursdays and Fridays and we did 8-hour shifts. Now, when you first come to the hospital, your very, very first day, you will go through an orientation process. They're not gonna just throw you out there, at least I hope not. You typically, from every school that I've heard of, including mine, you will have at least one full day of orientation. So you're gonna, you know, you're gonna learn where things are, you're gonna learn about the hospital, what department you're gonna be in, you know, everything you need to know. The system, the computer system that they use, they're gonna really take that day to get you familiar with everything. As soon as the next day, you might be on the floor and working already. So it happens pretty quick once you're in. Now, up to this point, everything's pretty much the same as far as I know for most schools, but once you're in the clinical site, it's very dependent upon your instructor as well as your school, what you can do, what your actual assignment is, and so forth. So for me personally, I was assigned one patient per week, and I would essentially kind of follow the nurse of that patient and help them with other tasks that they have, other patients they have, but I would be solely responsible for my one assigned patient per week. So that means doing any physician orders, taking their vitals, giving their medications, doing their dressing changes, you know, whatever it entailed. Other students in my cohort at other hospitals, they took on more patients, but because of the type of facility that I was at, we did it this way with one patient per week. So you may have multiple patients, you may only have one, and you might even just follow one nurse around and just kind of see what they do, maybe help out with whatever they're doing. But I can't 100% tell you what your exact assignment is going to be. All I can really tell you with certainty is like my experience and what I did. Now I want to tell you a little bit about what a day in my clinical life, that doesn't even make sense. Alright, so I want to tell you guys what a typical day looked like for me in clinicals in my first semester. Just to give you kind of an idea, I would get to the hospital at about 6 a.m. We would all meet up in a room with the instructor, get our assignment, then she would give us a sheet with the schedule of the nurses, and we'd find the nurse for our patient. And then after that, we were thrown out to the floor and we're there the rest of the day. I would initially find my nurse and introduce myself, tell her which patient of hers that I have so she knows. I would also tell her my responsibilities for that patient. So at the very beginning, we weren't allowed to give medication yet. So I would tell them, you know, I'm doing everything but medications. And just having that line of communication so they know what you're doing, what you can and can't do, so that they can feel free to ask you for help. So establish that line of communication. Then I would do rounds with them with the off-going shift. You want to know not only what's going on with your specific patient, but what's going on with the others around you, so that if something happens or you have to go in that room to help them, you're apprised to the situation. So definitely I'd be taking notes at this point, anything that stood out, any pertinent information, and certainly anything that had to do with my patient. Why is this making me out of breath? I don't know what's wrong with me. So I do my vitals on my patients every morning and make sure it's logged in the computer and ready to go, whether I'm administering the medication or if the other RN is, well, I'm not RN yet, but if the RN is gonna administer the medication, that way it's there and she knows, or he knows, or I know, whoever's doing it knows. Then I just do a quick head-to-toe assessment before it's time for medication administration. If I was gonna administer the medication that day, I would have a set time from my professor, and then we would meet at that time and I'd administer it and she'd watch. If it wasn't my day to do it, then the RN would just administer as usual. So after medication was given and everything's been charted, I know my patient's doing well. I've looked up what orders they have, and I'm making sure that in the back of my mind, I know, okay, if they have a 2 o'clock medicine, I'll be back at 2, or I need to do their dressing change right at 1. So I have the orders and my duties regarding that patient in the back of my mind, but it's not so hectic, and you know, I have a lot of free time now. So this will be the time that I ask different nurses if they need help. I seek out opportunities. For a while I really enjoyed following the wound nurse, so I got to see some gnarly wounds. I don't know why. I want to look over there, but I should look over here. But I followed the wound nurse for a while and I got to see some gnarly wounds, guys.
Oh, gnarly!
Like stage 4 pressure ulcer all the way to the coccyx. It's funny because I used to kind of like, I don't know, when I'm at home and I see like gnarly wounds like that, I mean, it doesn't bother me that much, but it does kind of make my stomach twist a little bit. But for some reason, when I'm at the hospital or like at work or whatever, and I see that, I'm just like, oh, that's awesome. I know, guys, I got problems. Find the good stuff so that you get experience, guys. All right, now that you guys kind of have an idea of what to expect, you know, a general idea, I just want to give you a few tips that I learned along the way that I hope could help you guys out. So my first tip is always know the most recent labs on your patient, especially before giving medication. This is just kind of a good habit to get into early on because you're going to be doing this more as an RN. And your instructor might even ask you, and it could be something as simple as if you're giving your patient like cholesterol medicine, like a statin, they might ask you, oh, so what were their triglyceride, gosh darn it, what were their triglyceride levels, you know? So just knowing that, knowing how to find it on the computer, kind of understanding its connection to the care you're giving or the medication you're administering, it helps you really better understand the health status of your patient. All right, so my second tip is, this is particularly pertaining to cardiac medication, but always check and see if there are parameters on your patient's medication. So when it comes to cardiac medication, you'll usually see in the MAR, it'll say hold if systolic is less than 110 or apical pulse is less than 60. So just keep in mind, when it's the day that you're giving medication, just check that MAR and see if there are any parameters. So sometimes it gets a little hectic and crazy and you're nervous because you know your teacher is coming, but it'll be super awkward if they get there and you're like, and they ask you, all right, so what was their blood pressure? And you're just like, so my tip is, when it's your day to give medication, just make sure you go through the list and check if there are any parameters and make sure you get those readings and that the parameters are met before you administer medication. That way you're not caught off guard and you're super prepared. All right, tip 3, this is gonna be very short. Document everything. This is just gonna be a golden rule for the rest of your life. Just, if you didn't document it, it didn't happen. So whether it's something for your patient or you did a treatment on another patient, always document. And then my last tip is to push yourself out of your comfort zone. So even if you're super nervous and maybe even a little scared, just force yourself to get out of that comfort zone and do things that you might not typically do or that you might not want to do, because it'll really help you grow and learn. So for me, this was a couple things. The first thing was I'm super introverted, so when it would come to doing patient interviews, I'd be like this little clamshell, like, oh my god, what do I say? Like, I'm nervous. Like, are they gonna be mad that I'm even bugging them right now? But I just forced myself to be confident and just talk to them and, you know, try and come up with the most natural things to say. And the more I did it, like, now it's like second nature. I could just walk into some random person's room and just strike up a conversation and it's totally normal to me. But it was super hard for me at first because I'm just really a shy person naturally. So, but if you just push yourself, you could totally do it. The other thing is, this is the real kicker. You know, I've been a caregiver, so, you know, I've dealt with poop, pee, anything. It doesn't bother me. But for some reason, like, mucus, like, I know, I can't. Just count me out. But of course, you know, I get put at the subacute unit, so we got mucus galore. One of the, like, most prominent things that I had to do there was suctioning trachs and doing dressing changes and all that. So mucus is definitely on the menu every day. I just remember the first day the teacher showed us how to suction. And, you know, we've done it in the lab, we've done it at school, but it's different in real life, okay? So, but the patient actually, like, shot up when it hit the reflex. And I think it kind of freaked all of us out because we weren't expecting it, and it was just crazy. And so, you know, this was my first day and I'm thinking, I don't know if I can do this. Like, that's crazy. You know, I just pushed myself to do it. I didn't even think anything of it. Now I have to admit, like, the first few weeks were kind of tough. Especially because you don't want them to think that it grosses you out. So you're over here like trying to be like, hey, yeah. But in your head you're like, after a couple weeks of doing it, it's nothing. You know, now I'm at the point where I love doing trach care. I love, you know, it's the most satisfying and good feeling when you, like, take a soiled dressing, you know, a patient that's in discomfort, and you clean it all up you get their airways cleared out and you can see that they feel so much better. And it's so satisfying. Not even just because it looks better, but you can tell that you genuinely made them feel better and that you helped them. So it's such an awesome feeling. And just the more you do it, it becomes second nature. You don't even think anything of it. It's not gross anymore. It's super easy. So my point is, even the grossest things that you think you can't even handle, trust me, if you just go out of your comfort zone and push yourself to do it, you'd be so surprised at the things you can accomplish. Anything you set your mind to. Don't ever forget that. All right, for the next part. What's in my clinical bag? Okay, let's see. So this is the bag I got. It's freaking huge. I got it from Amazon, of course, because what don't I get from Amazon? The first thing in my clinical bag is a drug guide. This one my dad gave me when I first got accepted in the program. It's a Walters Kluwer one. Your school will probably recommend which one they want for you. If not, this one's a good one. I know the Davis one is highly recommended. You could also get apps on your phone, and some of my classmates have this little tiny pocket one. So whichever form you want is super helpful. I actually referenced this several times while I was at the clinical site. Okay. This clipboard. This thing is awesome. So not only is it a clipboard, but it has like a cheat sheet on the back. And it has conversions, it has pupil sizes, your lab values, so if you're trying to memorize your labs, right there for you. Different intramuscular injection sites. I just got this on Amazon, so highly recommend. I use this every single day. The next thing, my precious. This is a Littman Classic 3. Got it on. It's black with that rainbow detailing. And I highly recommend this. You know, it's a little bit expensive, but it's still affordable enough, especially considering you're gonna use it throughout nursing school and for several years after when you're an RN, so highly recommend. One of the things that really confirmed for me how good this was, when you're in subacute, a lot of people have ventilators on, so when you're trying to listen to their heart or their lung sounds, you kind of hear that air coming in and out. And there were some of my classmates that had kind of cheap quality stethoscopes, and they had a really hard time finding some of the sounds. But when I would go in with my Littman, I could literally hear everything. Then just quickly, just a manual blood pressure cuff. I just bought a cheap one on Amazon. It's always good to have one in your bag just in case. Also, I use these a ton, just little notebooks that you could take little notes, write down the vitals, you know, whatever you need to jot down. Then of course, snacks, an Advil, because you never know when you're gonna have a headache or when you're gonna need a snack because you may not get a lunch. I never told you that. Then I bought a bunch of these little baby Sharpies. There's always gonna be a time where you're gonna need a Sharpie. You'd be surprised how much you're gonna use this. But even just to write a label, you know, whatever it is, definitely invest in some Sharpies. Also, Post-its are super useful. If it's your day to give out medication, you can write a little note to the nurse just to remind them that the student's gonna give out meds, because, you know, they get in their routine and it might slip their mind. And of course, I got these forceps or Kelly clamps and scissors, which I used these a lot. I spent several days following the wound nurse, so there was a lot of bandages to cut. Fun stuff, I'm telling you. Of course you need pens. So yeah, that's what's in my bag. It looks like there's like a billion more things in there for some reason, but I assure you there's not. That's all I have for you guys today. Thank you so much for watching. I hope this was helpful and insightful. If you have any specific questions regarding clinicals, just leave a comment below and I'll answer those for you. Please subscribe and give me a thumbs up if you like this video. See you next week!